Good afternoon. Welcome to the Ohio Commission on Minority Health's Miscellaneous Supplemental Grants Application Technical Assistance Session. For background on this particular grant type, the Commission funds miscellaneous grants based on the availability of funding each year. So this particular grant type is not guaranteed from year to year. Grants that are funded must reach at least 2 counties and have a focus on racial and ethnic populations. The MGS Grant Fund is designed to sponsor health-related activities, those that raise the visibility of the Commission and increase the focus of minority health disparities. And they focus on chronic diseases such as, but not limited to, lupus, infant mortality, or even cardiovascular disease. Further to all Commission-funded grants, we are mandated to serve African Americans, Asian Americans, Hispanic and Latino Americans, as well as Native Americans. However, anyone is able to attend an event funded by the Commission regardless of their race and ethnicity, as all of our events are free and open to the public. It should also be noted that this particular source of funding is not designed to support ongoing or long-term programming. New to the MGS application process is that it is now electronic. The Minority Health Grants Management System, and you'll see this acronym frequently now, MHGM, is the Commission's new online electronic grant application system. All applicants must use this system to submit applications for Commission funding. No paper, hand-delivered, faxed, emailed, or UPS or US mailed applications will be accepted. Additionally, if awarded, all grantees must use the MHGM system to support all program and fiscal reports. With regard to one's eligibility for an MGS grant, within the MHGM system, you must upload a copy of your agency's 501c3 letter. So please know that at the time you sit down to submit this application, you must be a current 501c3 entity. And again, you're going to need to upload the IRS letter into the MHGM system with your application. Even if you have been previously funded, you must still submit this particular documentation every year. Local health departments or health districts are exempt from this requirement, and you are able and eligible to apply for an MGS grant. Further to eligibility to receive funding, you must demonstrate that at least 20% of your funds will be received from an entity other than the Commission. You must provide services in close proximity to minority communities, and they must include minority communities in your stated service area. You must meet all licensure and certification requirements for the state of Ohio, and you must comply with all current and applicable laws, regulations, rules, and administrative guidelines of the Ohio Commission on Minority Health. And a very important moment here with regard to eligibility, you must be in good standing with the state of Ohio's auditor's office. I won't read the slide in its entirety, as this is a pre-recorded webinar, so you're able to read this in its entirety at your own pace, but you must be in good standing, and you must know this and understand this prior to your applying. If it's found that you are not in good standing at the time of application, your application will not be reviewed. The MGS funding at this particular time has a maximum funding amount of $5,000. And again, funding levels vary from year to year, and we will be based on the amount of funds available at the end of, within a given fiscal year. So at present, the Commission will consider sponsorship for activities up to a maximum of $5,000. The submission deadline is fluid for an MGS application, but the fluidity depends on you. Your funding request must be submitted in the MHGM system at least 90 days prior to the date of your event. Additionally, for events that occur after July 1st, you'll want to make sure that you get your applications in by May 1st in a given year to ensure that there is a time to have the proposal reviewed and sent to the board. So everyone, despite your portion of the year that your event will take place, please make sure that your application is submitted and complete in the MHGM system at least 90 days prior to your event date. If it is not received by that time frame, it will not be reviewed for funding. With regard to how to use our system, we do offer a training for technical assistance in general on how to access the system. And you can access this pre-recorded session at www.mih.ohio.gov on our Grant Opportunities page. This particular webinar will show you specifically how to submit the MGS application in our new grants management system. With regard to grant requirements, applications in the MHGM system will include, but not be limited to, a brief introduction of your agency, the population it serves, a detailed description of your health promotion and educational activity. You must also describe your target racial and ethnic populations in addition to the number of individuals you intend to serve. Again, you must have a 2-county impact area at a minimum. You must include an overview of your marketing plan, again, that must reach at least 2 counties, and you'll have to implement and administer a participant survey. Once you have held your events, you will also be able to provide an overview of the demographic data collection process for each county and each population you're going to serve. And forgive me, this is part of the application process, not the reporting. You will need to describe your demographic data collection process for each county and each population served. Please forgive me. You'll have to document your liability of insurance, and the amount that you are requesting for sponsorship must be included. Again, the cap is $5,000. And again, if you are applying for a community event sponsorship, all of your activities must be free and open to the public. If you are going to provide health screenings, all funds must support your screening and related costs. Please also note, if you're applying for a conference sponsorship, all of your funds must support conference registration, scholarships, and conference costs, and you must be able to document the process by which you are actually going to implement the scholarship process. And furthermore, please don't forget, we keep saying this over and over because this has always been an issue, please don't forget to submit a copy of your IRS 501c3 determination letter with your application in the MHGM system. Now, once your grant is approved, please know it's considered a contract, and the scope of your grant cannot be changed without prior approval. Your grant would have been at that point approved by the board of our commission, so any change to that would impact the scope of your project. So changes to your proposed activity, and we understand that these happen from time to time, they must be submitted in writing to the commission as soon as possible. Your changes must be approved by the commission, and you must have received them in writing before you implement them. Failure to submit your changes to us prior to implementation may jeopardize your funding. And again, if changes are made, you must make sure that your changes are communicated to the community in which you intend to serve in enough time where they're able to accommodate those changes for attendance. With regard to final reporting, if you were funded, you'll have to submit your final report in the MHGM system, and that final report will include, but not be limited to, your reporting on the collection of the demographics. You need to be prepared to talk about the race and ethnicity, the gender and the age and the county and zip code of your participants. And again, the number of participants. You're going to be able to collect and summarize and report on the participant event satisfaction survey results. And you're going to be asked to summarize your event activities in detail to include any screening demographics, if they were even provided, the marketing strategies you employed and how well they worked, the estimated number in attendance, your county served, challenges and successes with your program implementation. With regard to marketing, this is very important. Any flyer or media or audio visuals, things of that nature that are created to promote your event must have pre-approval. You must submit those to the commission before you incur any costs. And you can do so by stating one of the following items on your marketing material, either funded by the Ohio Commission on Minority Health, and you're able to use that with our seal, or funded in part by the Ohio Commission on Minority Health, again, with or without our seal above the verbiage. The most important part is to have the wording, because you can't necessarily see the seal at all times depending upon the size of your particular marketing tool. But at the very least, you must have one or two of those funding attributes on your marketing material, be that your website, flyers, spoken aloud on a radio, PSA. Again, we would work with you upon your submission of this material for pre-approval once you are funded. If you're going to use signage and banners through the funding process, you should make sure they're of high quality and that they're visible, and they shouldn't contain a date so that you're able to use them again in the future. Moving on to fiscal guidelines, here are several general fiscal guidelines to follow. Your funding period will be determined by the event date. So you want to make sure that, again, you get this process started as soon as possible and make sure at a minimum you are 90 days out from your event date. Your administrative costs can be charged up to 15% of your actual expenditures. So for example, if you submit a budget for $5,000, you're able to have administrative costs up to $750. The budget and the budget narrative should support the proposed activities. Your budget narrative must be clear and detailed and not exceed the amount requested. And each line must have narrative provided. Your budget narrative must also include itemization and provide a unit cost for each line item. That includes costs per copy times how many copies you need. That includes the number of flyers times how much it costs to print each flyer. Be very clear in those itemizations and costs per unit. We'll now move into the actual implementation process, or submission process, if you'll allow me time to move out and into the system. Once you have registered and receive your user credentials, you'll be able to sign in as I am. So allow me a moment, please, to sign in. Please forgive the time it takes this test area of the system to load. Your actual area where you log in should not take this long, but again, it will depend on the type of computer you're using. Is it a personal computer? Is it, at an agency that has a larger server? So you'll want to allow yourself some time and be patient, as I'm trying to be patient while the website loads, or I should say the grants administration portal loads. So again, please excuse this downtime. I was hoping it wouldn't take this long for you. If you should have any questions throughout this webinar, please make a note, write them down. You'll be able to submit them in writing, and I'll show you the process to do that at the end of this webinar this afternoon. All right, here we go. So as you can see, it's telling me my session is about to expire. That's a warning, just letting you know to stay in the entry process for your application. Yours will not come up so quickly, but that is a warning for you to see how much time you have left. So I am going to go into a test application to show you. And so I will go to MGS. Once your application is actually started, you'll be able to find your application in a similar fashion. So I go to View. Okay, here are the sections of the actual application. They're all listed for you on the left in my test application. When you begin to enter your application, the only sections that will show on this side are those that are available for you to enter. And as you progress through the application, the next section will be listed for you. And as you complete that section, the next section will be listed for you, so on and so forth until you get down to the submit portion. You'll see there is a session expiration counter in the upper right-hand corner. It'll help you see how much time you have left till your session expires. As long as you continue to work on a given page, your session will continue. You will not have only 58 seconds in your session. This again is the test environment. In 5-minute intervals, the system will refresh as long as you are typing in the system. If you should stop typing in the system, you have a warning that will come up so that you're able to say whether or not you want to continue in that particular session, and then you'll be able to continue working on your current page. If you walk away and the system logs you out, you'll have an opportunity to log back in, and the system will prompt you to be able to save the work that you've entered thus far. If you walk away and don't log back in, you could potentially lose the work on your page. So please make sure that you are paying attention to the timing feature in the upper right-hand corner. But again, as long as you are typing or moving the cursor on a page, your time will refresh. So here we have the face sheet. You will enter the name of your organization, the address. This is very straightforward. The particular fiscal year for which you are entering. You'll have a drop-down menu. My application's already started, so I won't let me do that in this page, but you'll have a drop-down menu of which fiscal year. Always type in the fiscal year that you're seeking, for which you're seeking to apply. You will select your grant type. Your miscellaneous supplemental grant will be the only project area available once you select that grant type. The system will automatically give you an application number. Your requested amount, you're only able to have up to $5,000, and then you'll let us know a little more about your entity, the amount of time you've been in existence. You'll title your program name, and then you'll give the contact information for all of your project director, executive director, and your fiscal officer. Project lead is on the commission side. You won't need to worry about that. Once your information is entered, you hit next. You're then taken to the organization information page. This information will pre-populate based on what you've entered on the face sheet. You'll also see that you have your congressional district that is listed. Should your grant be funded, we will notify your particular legislator, so let them know that a grant in their particular congressional district has been funded. So you'll check this page to make sure that the information is correct. If it isn't, you'll have to send an email to the commission so that we're able to change that for you, as this page is not, you are not able to edit this page as an applicant. So you can just check this information. If it's all correct, you hit next. You're then taken to the proposal narrative. This is the meat of your RFP. So you can see I'll scroll down, you'll be able to see this information. So at the top of the page, you're going to specifically state what health area you intend to cover. You can check one or more of these areas. So if you're only going to focus on cardiovascular disease, that's all that you need to check. For your demographics, you'll check any or all that apply to your particular proposal. It could be one, it could be all of them, it could be two of them, whatever applies to your particular grant. The gender on which you're focused, you'll check that area, and the age groups. Then you're going to move on down here into description of the applicant agency. And you're going to need to just simply respond to each of these particular questions or statements in these comment boxes. The first of which says your agency will acknowledge that the event must be free and open to the public. So you'll just start entering your information. I'm just going to click test so that you can see that there's a character count here at the bottom for you, as all of these boxes have a max character count. You'll be able to see that character count as soon as you begin typing into a given box. This particular box has 3,000 characters, not words, but characters. That includes letters, spaces, and punctuation. So please make note of that to adjust what you're able to enter, and be as specific and as succinct as possible. So you will enter your response to this particular question, which will be that our agency acknowledges that this event will be free and open to the public. But I just clicked test entry here for your, and then you'd go on down to each of the other boxes, and you would then respond to each of these particular areas. Again, they will all provide you with their character limit. You'll then scroll down to the bottom of the page where it talks about your element of sustainability. that particular information deals with how will you put this event on in the future should commission funding not be available. Will you change your administrative policies and procedures to incorporate it into your present structure of business? Will you seek other funding? So let's just click alternative funding, or we can put, well, we'll just keep alternative funding. And you can just say other grant resources such as, and then enter those, whatever those may be. And then you will click add. And as you can see, my test entry is down here at the bottom listed in elements of sustainability addressed. New to this process also is the administrative compliance component, which used to be a form in and of itself. You'll simply answer those two questions here in the MGS electronic application. Once you have answered all of these items on this page, you will then click Next. And as you can see, since I did not have any information entered into the boxes, the page did not allow me to leave, which is a safety feature for you, letting you know, hey, you can't progress in this application until you've addressed each of the questions. So I will put test in each of these boxes to allow us to move through the application. You will, of course, answer each of the questions, again, being very concise yet complete in each of the text boxes. So we're just going to enter that. Oops. Keep the English test. 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 Okay. Again, you will answer each of these questions fully and completely. I'm just entering test, so it will allow us to move through the application. You can also see that the application checked for errors here at the bottom, so you'll be able to either fix them now or click here to go on with the application. I highly recommend you fix the errors now. You don't want to take a chance on accidentally hitting the submit application with errors in your application. So we shall move on. Next, you'll go to the project action plan. This is where you will tell us what type of activity and how you will evaluate the activity. So I will review what we have at present and show, oh no, you know what, I won't review. I will edit to show you the project action plan. That'll show you the steps. To complete the project action plan, you must define your project model, the goals, objectives, approaches, and activities. Then you'll have an opportunity to review. So for your project model type, you will simply click on Other as an MGS grant. Your project model, you are going to select Miscellaneous Supplemental Grant. That will pre-populate that grayed out box for you. Your type of interest, you're going to reach a new audience, and the start date of your grant, we've put in a sample start date and end date. You can either at this point either save and finish later or move on to the next section. So we're going to move on to the next section. You must now define your goal. And you'll see here that you must choose a desired goal for this project model. You have to choose at least one. And since the supplemental grant is just for a one-time activity, the goal that you have for this is to hold a one-time health-related event that will increase the focus of minority health disparities, chronic diseases. So you'll check on that box, and then you'll hit next section. You'll now define your objectives, the number of persons that are going to be served at your event, the number of persons that will with screenings, if you have screenings, the number of people that will be served at your event if you're not having screenings. As you can see, there's no screenings at the end of that sentence, and the number of scholarships to be supported for your conference or training. So again, if you're going to have a conference, you'll click this box. And to enter the numbers that you'll have served at your event, you'll have to click this box. If you're going to have screenings at your event, you'll need to click this box. So you will determine this based on the event that you're seeking to hold. So for our purposes, we're going to hold a one-time event, and we're going to talk about the number of scholarships that were supported through this event. Then we'll click on next session. Clicking on the next section also saves the information on the page that you are present. Now you can see we're on the define objective section still, because we have to come in to say how many people we will serve. So recognizing that this particular grant management system works for more than one state agency, it doesn't quite fit grammatically how we would have you complete the project narrative in our old paper-based um, grant application. So bear with us. This is the new system, and this is how we have to enter this particular data. So you can see in the tan box that your goal for this objective is to hold a one-time health-related event that will focus on chronic disease. So your evaluation of this objective is down here. In this grant year for the objective listed above, let's say you're going to serve 100 people. You're going to want 100 people to have met or to attend your event. So you're going to say in this particular grant year for the above listed objective, you're going to want 100 of 100 people to attend this event, because if you're seeking to serve 100 people, those two numbers are going to be the same. If you're seeking to serve 50 people, both of those numbers will say 50. And then you're going to come down here and choose your level of change. Is that going to be community-based, family, or individual? And since you are seeking to have, in this particular sample, a conference, you're going to be at the individual level. And then here, the linkages between the program design and the goals and objectives of the program you intend to achieve. You're just going to talk about how will this program help you provide or how will this program be able to increase the knowledge of those that attend based on whatever disease and condition you're seeking to cover? So you'll answer that question there. And then you will supply details for the next objective. Oh, I forgot, I must answer that. You will answer that question fully, but then we'll go on to the next objective. And so you'll finish out in this manner for every objective that you are seeking to meet. So you'll do the same number in these boxes. We'll just do a 100 again, because we want to make sure that we reach all 100, and they will have an increase in understanding this information that you're sharing. Put test, and then we'll move on to the next section. This time we've moved on to define your approaches and activities. So here you're going to give us a detailed description of your approach, and you're going to hold a conference on, and then you will enter conference information here, if I can type. So forgive me. So you'll enter that detail here. You have plenty of character spaces left, as this has a 3,000 character limit. Then you'll come down and you'll look again at the number you're projecting. You're projecting 100 people. You'll enter your date range of when your event is. It's one day, so this will be the same day, the start and the end date. Your proposed day in operation is your event date and time. I'm sorry, your event, your event days and time. And then you're going to talk about how those services are medically and technically accurate. So it could be that you are having professionals from your given field of information come to talk about your given issue. You'll describe that information here. And then I will put test here, and I will put test here, and I will put a start date, let's just say of the 26th, and I'll say here it'll also end on the 26th, and then we'll see if I didn't make any mistakes on this page. It'll let me go. Oh, I must do at least one activity, forgive me. I didn't check the box. You have to check the box that you're doing your one activity, forgive me. And you've described your activity in this area here, please forgive me. So now it should let me go ahead. This talks about the next objective. So you're going to talk about what the approach is for the scholarships you intend to provide. So you will answer it fully. I will put in test. We're going to say 100, and we're going to do the same start and end date. We said the 26th. The 26th. We're going to put in test. Again, you will answer these sections fully. I am just putting in test information so that you're able to see how we move through these pages. Okay, I forgot to check that box. See, I'm so glad this system helps us do that. So it'll help us provide the best, most successful application possible. We put in some checks and balances for you. Once you've completed this section, your whole goals and objectives will be displayed here for you to review. If these are all correct, you're able to just click on Done. Okay. You'll then be able to move on to the next section of the application, which is the line item budget. This particular area allows you to enter your personnel. If you enter, this is a test document, so I can't enter anything into these boxes, but for every personnel person that is listed, you have to enter their amount in the last quarter, because you're only a one-time event. So you want to enter them in quarter 4 of the event, and then put them into the narrative box. And then if there's other funding that you'll put that into the other funding category and put narrative there. So every category that you have a line item, you must also include narrative. You must include narrative. You do the same for fringe benefits, other, mileage, so on and so forth. And at the last iteration of our test, you were to enter all of that information in the quarter 4 portion of this application. Then you'll complete the application. You'll put your total down here at the bottom, and as long as it is within the range that you said you were going to apply, you'll be able to submit the budget. You do not want to go over that amount. I changed the budget amount before, so it might not let me progress because I said the total amount of the budget was going to be 5,000. So let me see if I did not mess that up when I changed that at the beginning of the application to show you, and I did not. Perfect. Okay. So from this point, this is the project documentation page. This is where you upload documents that are a part of the application. And this is where you also download documents that are required. You have to download the Civil Rights Act, the Rehabilitation Act, and the W-9 form, save them to your computer, print them out, sign them, and then you will upload them down here in this section. So for instance, if you're uploading your Civil Rights Act, you would click on that document type. You would then click, just say that it was the Civil Rights document or Civil Rights Act form, however you want to title that. You do not have to have a REAP evaluator. You can ignore that. And since this application may not let you submit it, you can just put not applicable, because you want to make sure that you're not leaving a box blank. And then you'll choose the file and you will upload it. You'll do the same thing for each of the documents here, but you have to download them, print them off, sign them, and then upload them again here in this particular area. To the right of the screen, you will see all of the items that are mandatory for submission in your MGS application. You'll need to upload your 501c3, the administrative compliance, the Civil Rights Act form, which is there for you, the grant signature form, which is there for you, your Rehabilitation Act, your signed AOT once your grant has been approved, any resumes for speakers. Anywhere you see an asterisk is a form that you must upload in the application. And then once that is done and uploaded, you'll be able to see an area where you've uploaded all of your documents. Again, this is just a test area. And then you'll come down to talk about your financial reporting. For your audit, you will check those appropriate boxes, and from the drop-down menus, you will also update your proof of viability form and let us know that information, and then you will click Next. The Rehabilitation Act form is missing. So had this been your application, you would have gotten a warning that said what is missing. You'll be able to upload it at that time. So for the purpose of this application, I will just click on the next screen. This particular screen is the signature page. Your executive director, project director, and fiscal officer will each need to have access to this system, so they will need to go they will need to gain access into this system, get their credentials through the registration process, and then go in the system. They'll need to download their own form, sign it, and upload it into the application. They will also need to check the I agree box because this particular page says by checking the box, it's the equivalent of a digital signature. Also, by checking this box, you indicate that you agree to the submission of this grant, and you can read the remainder of this screen, but that is what this digital signature page means. But they must download the form, print it off, sign it, and upload it into the application in that project documentation page, and then check the I agree box to ensure that they have properly completed this section. And then we'll go to the submit page. This is the last page, of course, that lets you know that your application has been completed, lets you know who your project lead will be in the commission, and then you will click submit. There's no submit button in this test environment, but there would be a submit button for you to submit here. And that is the conclusion of the application process. So if you'll allow me to go back to our webinar. All right, so we'll move on to the next slide. You can see the application sections that we just reviewed in the MHGM system. Just some system quick tips. Please gather all the materials you'll need to complete the application and just kind of have them nearby. Make sure that you are aware that your application session will expire in 30 minutes, again, in those 5-minute increments. So you want to make sure that you're actively typing or moving your cursor. You'll get a warning clock at 5 minutes, and you'll receive a pop-up display letting you know about that warning and allowing you to make a decision to save and start later or to continue working. Please do acknowledge those pop-ups, because if you are away from your desk and the system logs you out, if you try to log back in, you'll receive another indication asking you if you'd like to retrieve your unsaved data. Please do hit yes so you don't lose the data that was entered prior to the system timing out. Again, to help save your information, you click the complete all the information on a page and click next. Or as you saw in the application process in the project action plan section, you can actually hit save and finish later as well if you have to step away and come back. Fields with the red asterisks on that on that documentation page are required and must be downloaded, signed, and uploaded with your application. Remember, the count boxes on those narrative boxes and the questions are character counts and not word counts. We give you a few of those examples here. So some people have opted to respond to all the questions in a Word document and then copy and paste them into the application itself. So they're able to keep track of that word count, but you really don't have to, because there's an actual, character count, not word count, character count in the application system. It's built right in there for you, so you don't have to copy and paste. You can just type and watch your word count. So what to expect next? So pre-award, you're going to develop your proposal and submit it in the system at least 90 days prior to your event. Your application will be received and it will be reviewed. And if it is reviewed for funding, it'll move on to the grants committee, and from the grants committee, it will go to the board. The board makes the ultimate decision on whether or not to fund a grant. If your grant is awarded, you'll receive a notice of grant award, as will your area legislator. You'll also receive post-award special conditions, both program and fiscal. If you should have those special conditions, you'll have a time frame that you'll be given in your AOT, or acknowledgement of terms, as to when they have to be submitted in the MHGM system. Your budget revision final date will, of course, depend on when your grant is. So you'll want to make sure that you pay close attention to all of those dates that will be given to you in your AOT. Another reminder, please submit your application 90 days or more prior to your event date, because that deadline is not negotiable. We have to have the time to review your grant. We have to have time to get it to grants committee and to the board, and enough time to get all of your AOT sent out to you and to have all your program and special conditions addressed so that you can get an approved budget. It takes 90 days to do that. We want to make sure that you have plenty of time to do that. And again, your application must be submitted in the system, again, on that date, 90 days or more prior to your event date. If you have questions, this is what I was mentioning earlier, please submit your questions in writing to minhealth@mih.ohio.gov. We're only able to respond to questions in writing to ensure that we don't overstep our boundaries. We want to make sure that we're fair and complete in our questions, but that don't predisposition you to funding. We have to respond to questions according to the RFP, which again is an open RFP for the miscellaneous grant award amount. Once your question is answered, we'll send it directly to you, but we'll also have an update, a frequently asked question list that will be submitted on our webpage. All questions, please allow them at least 1 to 2 business days to which you should receive a response. If you want to learn more about us, you're welcome to call at 614-466-4000. You're welcome to visit our website. Look us up on Facebook or even LinkedIn, and we'll make sure that we have plenty of information to help you further understand the work and the mission of the Commission. We look forward to receiving your application, and we wish you well. Feel free to listen, stop this particular session as many times as you need to, or submit your questions in writing, and look at the frequently asked questions that will begin once we receive questions on the website. So take care. We look forward to receiving your application. Thanks so much.